Hi, welcome back again to my channel. If this is your first time here, you are most welcome and I do appreciate you. I'm not taking you for granted. I know I do say this in all my videos, but it's just the way I feel like the love. I don't take it for granted. Like the few persons who have been watching my videos, being it just one view, two views, or those 8 views I have on one of my videos, is very much appreciated. So today, I'm passionate about women's health. I'm passionate about we the ladies, it's a women's thing. Anyway, my channel is not just about women. Or of course, anytime I have the opportunity to educate women out there, I feel so enthusiastic about it. I feel happy about it and all. So today I wanted us to talk about a very common thing among women, which is yeast infection. Fungal infection. What do I mean by this? You are a lady, you might be having that vaginal discharge, you might be having that itch, and someone tells you, oh, you're having an infection, you're having a toilet infection, or whatever they call it. Yeast infection is not a toilet infection. Yeast infection is simply a fungal infection which is caused by Candida albicans. So how do one get this? You can get this through practices which you've done by yourself. There's also a disclaimer out there that yeast infection is a sexually transmitted infection. I stand and I tell you with my full chest that yeast infection is not a sexually transmitted infection. Yes. Anyways, so how do one get yeast infections? If you watch my previous videos where I emphasized on when people want to treat malaria and they keep on saying they have malaria and typhoid and they keep on taking antibiotics and antibiotics repeatedly, almost every month they are having typhoid and malaria. Those antibiotics are abusing. One of the repercussions, one of the side effects you're going to get from that is this so-called yeast infection you claim you are having because of and because of toilets or because of whatever you might say or someone might tell you. So what do I mean by this? When people abuse antibiotics or take antibiotics when they don't need it, the antibiotics tend to kill the good bacteria in our bodies, and one of it is the one in the vagina, which is the lactobacillus. So it tends to kill this good bacteria, which is supposed to be there to serve as a protection. And then once this is no more, the fungus tends to grow, of which in the normal sense supposed to be minimal, the lactobacillus is supposed to be more than it. It tends to grow way above this bacteria. In other words, there's no defense. The vagina does not have any defense, so it just grows out of the ordinary, and then there's a mismatch, imbalance between your vaginal pH, and as a result, it causes this vaginal itching, it causes the discharge, the thick whitish discharge you have, and all of that. So no, you're not having toilet infection. No, you're not having an STI, but you're having simply what is called a fungal slash yeast infection. So how can you prevent this? Please, whenever you notice any discharge, some people even feel like any discharge is bacteria, and so in order to cure it they need to take antibiotics, which results to them just going to a pharmacy and procuring antibiotics. Some discharge you might have might actually be bacteria, some might not be bacteria, some you don't even need to do anything about it. But then when you take these antibiotics when you don't even need it, it's worsening the entire condition. So in as much as I'm telling you it might be yeast infection, you don't have to go and buy a fungal medication. Go to the hospital and get tested. Let them be sure that this is what you have and let the appropriate medication be given to you. Are you hearing me? Yeah. All right. So moving on, how can you prevent this? Please get diagnosed properly and treated properly. Avoid getting self medications. Get getting treated at the pharmacy or by that your friend who is a doctor who you just call and say, well, go to the hospital, get tested properly and get treated. avoid a lot of feminine wash out there who will tell you that when you use this, you're not going to have discharge. When you use this, you will not have that toilet infection. Avoid using all these so-called washes. I'm not saying they are bad. Of course, there are some of them you can use, but avoid putting them in your vagina because that will actually mess up your vaginal pH and leads to you having discharge and itching. Are you understanding what I'm trying to say? Yeah. So safe practices such as douching, avoid putting soap in your vagina, avoid inserting whatever in your vagina because all of that are going to mess up your vagina pH. Those of you who are doing that thing with multiple partners, please, that could also mess up your vaginal pH. Are you listening to what I'm saying? Anyway, I'm not going to say much about that. Also, a lot of you who cannot take tea without a lot of sugar. A lot of you who cannot go a day without that cupcake, without that cookies. Oh, I need to take a lot of sweet things. Oh, I have sweet mouth, I have this, I have that. This whole fungal stuff, they thrive on sugar, you know, which is why, for someone who is diabetic, uncontrolled diabetes and all of that, one of the symptoms is experience is this vaginal discharge. What I'm trying to say is try and cut down your sugar intake. Yeah. So that's that about that. And then how can this be cured? The treatment simply is not antibiotics, it's just antifungal medications, which comes in creams, tablets, and whatnot. Just get tested and get treated properly. Thank you for watching this video and I appreciate it. Share it to all your female friends, especially secondary school students and all. And I will see you in my next video. Bye. And sorry for the noise in this video. There's a lot of noise in my house. Actually, I had to come hide somewhere to make this video. Just manage it like that. But I will see you in my next video. Bye bye.